Good time to everyone. As you know, the early diagnosis of neurodegenerative diseases, particularly Alzheimer's disease, remains a critical challenge in clinical practice. Here, I will present a 20 years old study regarding plasma beta amyloid and phospho-tau levels in patients with dementia and mild cognitive impairment. Plasma biomarkers, including beta amyloid and phospho-tau, have gained attention as diagnostic non-invasive tools. 2 decades ago, our study was pioneering in measuring these biomarkers in plasma. At that time, the correlation between plasma beta amyloid and phospho-tau in dementias lacked exploration. Here, I would like to carry the memory of Professor Stavros Bolianis, who, with my deep sadness, has passed away about 1 year ago. He was a guiding light who profoundly shaped this professional journey. It was his insightful suggestion to explore biomarker measurements in serum samples and not the CSF that became a cornerstone of my work 20 years before, and still studies on plasma beta amyloid 42 and phospho-tau levels across different dementias are sparse. His wisdom and calm presence flowed through my life like a stream of water, gently nourishing and shaping my path. Grateful for the legacy he leaves behind. Our objective was to evaluate plasma beta amyloid 42 and phospho-tau levels across mild cognitive impairment, dementia of Lewy bodies, Alzheimer's disease, vascular cognitive impairment, frontotemporal dementia, and normal controls, and explore their potential as diagnostic biomarkers. This study concluded 74 participants, 7 MCI, 29 Alzheimer's disease, 6 dementia of Lewy body, 13 vascular cognitive impairments, and 3 frontotemporal dementia, and also 16 controls. Beta amyloid 42 and phospho-tau 141 levels were assessed using ELISA method that is used based on interaction of antigen antibody. To improve the sensitivity for phospho-tau detection, we doubled the plasma sample volume, dividing the final results to normalize for concentration. Parallel testing confirmed no interference from these adjustments. Brain SPECT imaging was performed to confirm clinical diagnosis. Our results showed that there was no significant difference in concentration of plasma beta amyloid in Alzheimer's disease comparing normal controls, vascular cognitive impairment, frontotemporal dementia groups, but it was highly increased in dementia of Lewy body versus other groups. There was also a significant increase of beta amyloid in MCI, comparing Alzheimer's disease and normal groups. Phospho-tau concentration was detectable in plasma of 14 patients, 4 Alzheimer's disease, 3 dementia of Lewy bodies, 4 mild cognitive impairment, 2 vascular cognitive impairment, and 1 frontotemporal dementias, and in none of the normal controls. The interference which was done in the assay procedure had no effect in our final results. Among the patients which had detectable phospho-tau, there was no significant difference in Alzheimer's disease comparing vascular cognitive impairment and frontotemporal dementias. But there was a significant increase of phospho-tau in the patients with dementia of Lewy bodies versus Alzheimer's disease. Phospho-tau was detectable in 4 from 7 of the patients with mild cognitive impairment and in 3 from 6 of patients with dementia of Lewy bodies. An increase of phospho-tau in MCI was observed, which didn't show significant difference comparing dementia of Lewy bodies, but with other groups. And a significant correlation was found between plasma beta amyloid 42 and phospho-tau. In this way, a high increase of plasma beta amyloid 42 and phospho-tau levels in our patients with dementia of Lewy body and MCI compared to Alzheimer's disease controls and other groups was found. This increase may represent a potentially sensitive biochemical marker in dementia of Lewy body and sensitive biochemical risk factors to develop Alzheimer's disease in MCI. We can hypothesize that these elevations in MCI are reflections of efforts of the yet viable blood-brain barrier to remove the pathological peptides from central nervous system. Several evidences support the possibility that beta-amyloid and alpha-synuclein might interact to cause mitochondrial and plasma membrane injury. This injury may be severe enough to damage blood-brain barrier, and thus beta-amyloid and phospho-tau, which are not the main content of Lewy bodies, be released in larger amounts peripherally. In a study at 2006, Duca et al. Reported that the neurotoxin MPP induces hyperphosphorylation of tau in the presence of alpha-synuclein in neuroblastoma cells. It may potentially show the hyperphosphorylation of tau in the presence of alpha-synuclein. 3 of the patients with MCI showed a perfusion pattern of Alzheimer's disease, and 1 of them showed non-specific perfusion defects in single-photon emission tomography SPECT. The question which arises in mind is if these peptides are the biochemical risk factors in MCI. Another finding was the correlation of plasma beta-amyloid with phospho-tau levels in our patients. Possible mechanism for this association may be that beta-amyloid 42 elevates phospho-tau, or phospho-tau elevates beta-amyloid 42, or that both are increased by a third unknown factor. This association in our patients is explained by the factor of diagnosis. They were increased in dementia of Lewy bodies and MCI. Several studies found no significant effect of statins, estrogen, non-steroidal anti-inflammatory drugs, antioxidants, or cholinesterase inhibitors on plasma beta-amyloid levels. Blasco et al. Reported a significant decrease of plasma beta-amyloid in non-demented cases who were under medication with statins, ginkgo biloba, piracetam, and vitamin E, and a significant increase in insulin users. Our patients with dementia were under medication with cholinesterase inhibitors and vitamin E. None of the patients suffered from diabetes. All cases had normal blood creatinine and cholesterol levels. Till now, heterogeneity and inconsistency have been found among different studies. In this table, you can see all the studies till now that were consistent with our results. Some studies have found correlation between plasma beta-amyloid and PET deposition of beta-amyloid in the brain using positron emission tomography. The limitations of our study was a small sample size and lack of histopathological confirmation. In conclusion, it seems that after 20 years, we are still stuck in place regarding Alzheimer's disease. Our study suggests that elevated plasma beta-amyloid and phospho-tau levels can serve as sensitive diagnostic biomarkers in dementia of Lewy bodies and also potential risk factors in mild cognitive impairment. May measuring of plasma beta-amyloid in healthy subjects be used as a prognostic factor pointing to a risk of pending Alzheimer's disease? And also the amyloid hypothesis focusing on amyloid-beta plaques have driven Alzheimer's research for decades. Since Alzheimer's involve multiple pathways of neuroinflammation, should we focus on potential broader early diagnostic and therapeutic strategies beyond beta-amyloid? Thank you very much for your attention.